Hello, good afternoon friends. I am Dr. Vishwas Bhamre, practicing ophthalmologist in Nasik. I am practicing here since last 23 years. Today friends, we are going to talk about dry eye. Okay. This is the most common disease nowadays we are seeing in the ophthalmology because of use of digital, because of heavy use of digital equipments. We have some 3-4 type of dry eye problems in the different age groups. So if we see about the children's nowadays, because of last 2 years in COVID, everything was on the online. So in that case, all the children, say from the standard junior KG, senior KG to all the degree people, everything was on online. So because of high use of the screen, many people are suffering from dry eye problems. So how can we prevent the dry eye in the digital in the children when they are using either by default or because of their habits, they were using the screen for more time? Then we should take few cares, just like we should just tell them to blink the eyes more frequently. Okay, when we are reading or when we are on the screen, there is so much of concentration on the screen that normally the blinking rate should be 10 to 15 times per minute. It comes down to 7 to 8 times per minute when we are on the screen. So when there is a long time open because of the high exposure to the air and atmosphere, there is a evaporative dryness in the children. So blinking is more essential. Second thing, they should take frequent breaks. So suppose if they work for 30 minutes, then at least 2-3 minutes they should take a break and they should concentrate on the distant object. Okay. Then there should be proper brightness should be there in the room. It should not be more dark. It should not be heavily bright. The light should be proper. Then the distance. Okay, it should be at least 18 to 20 inches away from the eye. It should not be very close to the eye. It should not be very far from the eye. So distance should be proper, either for the reading or for the screen also. Okay. Then if the patient is having a spectacle correction, they have to use or they should use the proper spectacle number. If they are not using the proper spectacle number, again there is a lot of strain on the eyes, and that may also lead to the dryness and headache and all that symptoms are there. Okay. So this is for the particularly for the children who are mostly attending the lectures online and they are playing the games, different games. Okay. Second category, most of the people who are working in the software industry. If we are working for more than 5 to 6 hours on the screen per day, so always most of them are suffering from the dry eye. Again, the reason is same, because they are working or they are sitting on the software for continuously, so the blinking issue, and most of the time the office is air conditioned, so there is a dehydration of the more dehydration when the patient is sitting in long term for the air condition. So in that case, they are also suffering from dry eye. What care should we take? First thing is their sitting posture. The sitting posture should be proper. Screen distance should be proper, as I mentioned in the last time. Then there are a few anti-glare glasses are there, which will reduce the brightness of the screen. That will also helpful when you are sitting for more than 6 to 8 hours on the screen. So anti-glare gives some relief to the eyes, and the light in the office should not be very dark, or it should not be very powerful light. Again, the light should be proper, so that there is no direct strain of the light on the eyes, so eyes will be relaxed and they can concentrate more on the screen only. Then the screen setting, like resolution and brightness and all that thing, they should be properly adjusted, and distance should be 16 to 30 inches. And again, I am repeating the same thing for the children also and for the software industry. Blinking is the most essential part to avoid the dryness. Okay. If you blink more, the dryness should be there should not be a problem with the dryness. Okay. Blinking is the main cause of the dryness when patients are coming to OPD. So if the parents or the patient, they are directly complaining about the dryness or they are complaining the symptoms. So we always insist on blinking of the eyes. Okay. First thing is the blinking of the eyes. Second thing is take a frequent breaks and concentrate or focus on some distant object. Few studies says that the distant object should be a green color object like some tree or something like that. If the surrounding is open, then something, whatever it will be, but it should be a green color gives the most relief to the eyes. So that is one of the more important part. Then if you love for digital devices causing most in your eyes, you may suffer from the digital eye strain. So in that case, this dryness, in dryness also there are different type of dryness like evaporative dryness or maybe a dryness because of some mammalian gland dysfunction or some lid disorders, and dryness is because of diabetic patients or other people. There is a side effect of some drugs, or the glaucoma patient when they are putting a drop for lifetime. So again, because of that also the patients are suffering from the dryness. So whenever there is a problem with the eyes, if you have symptoms like redness, itching, irritation, uncomfortable feeling in the eyes, first thing you should do is you should consult with your ophthalmologist. Instead of directly purchasing any drops, any over-the-counter drops from the medical store, you should first consult with your ophthalmologist because he is the judge to rule out the exact reason for the dry eye. Okay. If it is a evaporative dry eye, then our treatment part is different. If it is a mammalian gland dysfunction or lid disease related dry eye, then again our treatment part changes. If it is because of some medicinal side effect, some drop side effect or some disease side effect, then we have to look after the exact cause of the dry eye and treat accordingly. Then only we will get the relief from the dry eye. Okay. So what happens? And second thing is normally what happens in conjunctivitis or in tube disease, we put a drop for 8 to 10 days and we get relieved. In dry eye, if nothing happens like that, we have to use the drops for the longer period, maybe for 1 month, maybe for 6 months, maybe for years, depending upon the your root cause of the dry eye. Okay. Second thing, what happens? See, a person who is working in the software industry, though we are treating him for the dry eye, we are giving him some drops, we are giving him some tablets, but the root cause is as he has to use the computer or he has to use the screen for longer time. That is always there. Okay, he cannot avoid the screen. So if we advise the patient, you don't sit on the screen for 8 to 10 days, that is not possible for him. He has to sit on the screen, and with that thing in the mind, we have to treat him. So it is always a long-term therapy because 8 to 15 days, by putting a drop for 8 to 15 days or for 1 month, nothing is going to happen. So first thing, when we start this treatment, we should instruct the patient that the treatment may take 3 months, 6 months or more than a year also according to your root cause. Okay. So as this is the most common disorder throughout the world, not in the India, it is throughout the world because of there are a lot of factors. Screen use is there, AC use is there, so people who are driving the two-wheelers, so they are directly getting exposed to the air, directly getting exposed to the this dust, and these are the very common things nowadays for the dry eye cause. Okay. So we should again I am repeating the same thing. We should first take a proper history of the patient, proper counseling of the patient. We should diagnose properly the root cause of the dry eye and treatment of the dry eye. By using all these methods, if we give the patients assurance and if we properly counsel the patient, so it can easily be treated, it can easily be, patient can get relieved. If there are few more tests are also there in the market nowadays, which when the patient is not getting relief with the regular treatment, we can advise the test also, and accordingly we can treat the patient also. Thank you.